Meet Dr. Karen Hamilton, a 1-in-a-million vet with a unique talent we call seeing eye fingers. By her gifted touch, she can communicate with her four-legged patients without the benefit of words. Every twitch, every movement, every flowing pulse, a conversation to her expert hands. They say if we lose one of our senses, that the others grow stronger to compensate for that loss. Maybe that's what happened with Dr. Hamilton. Without the luxury of communicating verbally with her patients, her sense of touch became a gift of touch to better diagnose and cure her patients.
Getting older is no fun. All these new aches and pains and new medical issues to deal with. And it's no different for our pets. Just like us, time takes a toll on our fur babies. As the years go by and their muzzles start to gray, age-related problems start to surface. And as much as we hate to think about it, our precious time left together is running out. These guys have spent their entire lives filling ours with their unconditional love and friendship. So it's no wonder that we want to keep our pets around and happy for as long as possible. Today, we are going to learn about some of the issues that face older dogs, how they are treated, and what warning signs to look out for, so you at home can make sure that your pet's golden years are filled with health and happiness. As pet owners, they look to us for help. We have a lot of tough decisions to make, and, like you'll soon see, the most difficult is knowing when it's time to say goodbye.
So that was Franly. She has a little Frankie. It's a little beagle mix, and we saw that dog a little bit ago, and we pulled some blood off the abdomen, and it has either a splenic tumor or a liver tumor, but regardless, the prognosis is very poor. They've decided to go ahead and have her humanely put down. So I understand that's a very hard decision, but that's what they've decided to do.
Sometimes it's necessary for the decision to be made to euthanize the dogs, and it's really to put them, it's for quality of life.
So we're going to do a house call at their house tomorrow. I'm going to take my daughter, and we're going to go around noon tomorrow.
This is her when she was puppy.
Oh my gosh.
And the breeder. So we would get new pictures every week of her.
She's still cute though. She's still got a
baby face. She does.
I know.
She's a
There's
beautiful baby.
that's mommy and daddy down at the bottom.
Oh.
And we got her at the airport, and I carried her all the way home in the car. Yeah.
She had some fluid in her abdomen. That was probably because of some cancerous cysts that were in there. So
Called it a splenic tumor or something.
yeah,
There was
and
blood in her stomach.
she was very anemic. So the prognosis wasn't good. So she went ahead and helped us put her to sleep in the living room, which was really great.
It was so much nicer than going to a clinic, because it was like we did that with another dog, and the dog was just so nervous and upset and getting her there, and they actually had to give her a tranquilizer to settle her down, and
Yeah.
it was more traumatic on both of us. And this way it was like she just went to sleep in the living room, and that was it.
Yep.
They opted to go ahead and put her out of her misery and suffering. She was having a hard time breathing because she was so anemic. She was pale mucous membranes, pale gums, and we decided to, rather than take the tumor out, to go ahead and humanely put her to sleep. So that's what we did, and we're going to take her back to our clinic now and have her cremated and do a little paw print for them.
So whenever the occasion comes up that someone needs to have their loved one put down, we like to make these clay paw prints. So for example, I made this for Frankie. And we have either a heart or a circle shape, and then we put their paw print there just sort of as a memento for the owner.
Just kidding.
Miss Fran, who you did the house call for, who you helped put her baby down, she stopped in. She wanted to say thank you, and she
Aw.
left this here for you.
That was so sweet.
She said she was very appreciative, and she just wanted to leave that for you.
Thank you so much for taking care of my Frankie. It was great to meet you. Sammy says you are the best. Hugs from Fran.
Oh,
That's
so
sweet. Oh my goodness. What is this? Oh, it's adorable.
It's so cute.
Look at that.
It's a
cute.
keychain.
It's cute. It's cute.
It's a keychain.
Thank you. I love it. That's Coach.
See for yourself. Today's patient is a border collie mix named Autumn. Her owner said at first Autumn just didn't seem like her usual spunky self. Then her symptoms started to get worse and make her worry that she might be seriously ill. Autumn was lethargic. She stopped eating, even her treats. When she did get up after a few minutes, she was right back down with a wince and a whine. Dr. Hamilton did not see any favoring of the limbs, and her symptoms were so many and so vague that it could be anything from a small injury to a major life-threatening challenge. As with all her cases, Dr. Hamilton begins her diagnostic process with a touch. Once Autumn is settled in on the exam table, she lets her seeing eye fingers go to work. She closes her eyes to focus on her hands as they begin to roam through Autumn's fur and limbs, searching, seeking, feeling. No surface wounds. No rashes or bumps. What's this? After a few moments of exploring, she felt an ever so slight variant in heat. Unsure, she closed her eyes and let her fingers do the talking once again. This time, she was certain she felt it. So she ordered an X-ray of the area to get a closer look. Luckily for Autumn, Dr. Hamilton was able to diagnose the problem and confirm it with an X-ray. Not something she ate, not a blood disease or a tumor. It was simply a hairline fracture, which caused the symptoms, yet did not reveal itself with the way she walked. After wrapping up the area, Dr. Hamilton sends her home with a clean bill of health.
Some older dogs can suffer from multiple ailments all at once. And owners need to decide what's worth trying to fix, what's worth trying to treat, and when it's best to let nature run its course. Like this case with a Cocker Spaniel named Chili Bean.
So Chili Bean came in several weeks ago with a mass on his neck and pretty severe dental tartar. That's probably what's really making him smell bad, but the owner wanted the mass taken off, and we've done a couple rounds of blood work, as I said, and we found out we put him on some antibiotics, and the blood work, instead of getting better, got worse. So because of that, we think that he has leukemia. This poor little guy, he's 14, and we might not, I have to make a phone call to the owner. I've already made it, and we had to leave a message, and they're supposed to call me back, so we'll see what happens.
Okay, so it sounds to me like I have two choices. I can go ahead and let him live with his mask,
Right,
or I can get it taken off so he can at least be more comfortable.
right. But know that he doesn't have long for this world.
Right. Do you recommend a third option?
Well, how does he do at home with the mask? I mean, does it bother him, or does it more bother you?
Well, it bothers him because it does, as far as comfort, you know, like when he's sleeping and things like
So
that.
he has two masks under that ear. He has one that's just kind of hanging there, and then he has one on his neck. The big one that's hanging there, I could just take that off. Okay, I can do that, and then at least he'll be comfortable, you know. Okay, and I can do that. I'll do that for, you know, I'll try to make this inexpensive as I can for you. Okay. Alrighty. Thank you. Bye bye.
And one of the things that I love about him is that when he goes out in the yard, he prances around like he's a show dog. And he goes around outside of the fence, like the show dogs do on TV. And so, yeah, he's just a great dog. I've had him a long time, so he's part of the family.
So this is what it came out to be, and it came up to be like, I forget what it was, $1,100. Mm-hmm. But for Christmas, I went ahead and gave you a discount.
Oh, thank you.
Merry Christmas.
And even though we know that our pets are going to pass at some point in time, I'm not ready for it for him. So anyhow, that was at the back of my mind, and I'm thankful that I came to my dog that's doing better and he's living. It's a great Christmas present. And my little guy came through with flying colors, so of course that makes me happy. And I'm just excited for the future for my little guy and for me. So thank you, Dr. Hamilton, very much.
Not all pets will get cancer, even though it is one of the leading causes of death in senior dogs. But they can still feel the strain of their years, just like we do. And also, just like people, mobility can become a major concern, and unfortunately, another leading reason for being euthanized. Thankfully, modern veterinary science provides a multitude of treatments, supplements, and exercises to help keep them feeling spunky well into their old age. Like Shiloh's mom, Karen Felton, who comes in for regular laser therapy sessions to treat joint pain.
Shiloh has arthritis pretty bad, so that's what we're doing the laser therapy on, the cold laser. She's got it on her elbows and her hips and her lower back a little bit too.
She's an 11-and-a-half-year-old black lab, and she started having trouble with her right elbow and her hips, where she was having problems walking, where her legs would just kind of go wonky and then they kind of give out when we take her for a walk. She can't play anymore. She used to play fetch for hours, and she can't do that anymore, but she's definitely walking better now, where her legs aren't going out as often. So we can definitely see a difference. It seems to help, and she seems like she likes them. She comes in here and she doesn't shake anymore. She just comes in, lays down, she's nice and relaxed.
Pets spend the best years of their lives loving, playing, and teaching us how important it is to live every day to the fullest. They say the only time our pets ever really hurt us is when they leave. I know we don't like to think about that day, but it is coming. For some, sooner than others. So it's our job as responsible and loving owners to give them the best life possible for as long as possible through medical care, good nutrition, and lots of love.
An ode to our veterinary heroes. Are they big and tall, or are they short and small? Can they hit a home run? Do they like to have fun? It's hard to say. Maybe they can play a song, or to a club they may belong. It's hard to say. What kind of car do they drive? Something fancy? Something nice? Do they always wear seatbelts and helmets when they bike? It's hard to say. What I can say for sure is when my pet needs a cure, we load Buddy in the car and we take him to the doctor. But it's not like humans. It's not a doctor. It's a vet. A man or woman soaked in slobber with a stethoscope around their neck. They don't wear ties or suits, golden chains or silly hats. But instead they wear lab coats and scrubs, decked out in dogs and cats. And when we arrive, we go straight to the front desk. The receptionist gives Buddy a treat and tells us that we're next. And just like me at the doctor, Buddy starts to feel afraid. All these posters and magazines asking, has your pet been neutered or spayed? Luckily for him, that was done years ago. And today is just a checkup, checking his eyes, ears, and throat. But this I do know, if something was seriously wrong, the vet would do anything to make our pup strong. You see, real heroes don't wear silly boots and capes. They wear paw-printed lab coats and play with dogs, cats, hedgehogs, and even snakes. And with that kind of heart, they should be on TV, do interviews and movies, be on the covers of magazines. But that's not why they work. Not for the glory or for the fame. It's not for the luxury or a notable name. They do it for us, for our families, for our pets. They do it for love and compassion. They're heroes. They're vets.
This is my baby Bruno. He's a golden retriever, 3 years old. The best golden retriever you'll ever meet. He's a sweetheart. This is my baby Nova. She's a Dogo Argentino and she's turning 6 this year.
This is my baby Mac. He's 2.5 years old. He's a Rottweiler. He is kind of the best dog ever. He's a little crazy though, but he is my first child.
He wants you. Tell us everything.
I like it. That was good.
I think you're funny.
That's great. I love that.
Did he? He's not invited anymore.
Okay. Because I want to get this, you guys.
You're so handsome, even with your doggy coat.
You're the one that put it there.